been feeling kind of blah lately. Is it my multiple sclerosis? Or is there something else going on? Well, hello and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam and I've been living with multiple sclerosis for 39 years. And I have to say that here we are in the depths of winter in the Northern Hemisphere. And while I've read a lot of studies that say that we actually have less fatigue in the cold months, normally that's even true for me. But this year, for some reason, I'm just kind of feeling, I don't know, lack of motivation compared to my normal. And I'd like to know what's going on. So I'm going to look into some of the resources that I found about something called seasonal affective disorder, and also just sunlight exposure in general and how that might affect my multiple sclerosis. And as usual, it's hard to tease out where one ends and the next one begins, but I think that you'll get some idea from this that it's something that it's worth paying attention to, because maybe it's been bothering you and you haven't really even noticed. Well, before we get too far into it, I think it's a good idea to make sure we know what we're talking about when we talk about seasonal affective disorder, or SAD. I'm sure you've heard about it. This was a big deal back in the 90s. There were a lot of papers written on it, and I know a lot of folks at work bought those fake window boxes that had the light coming through that emulated sunlight so that they wouldn't feel too light deprived by sitting in a windowless office all day. But here's what the Mayo Clinic has to say on the subject. They say that seasonal affective disorder, or SAD, is a type of depression that's related to changes in seasons. Seasonal affective disorder begins and ends at about the same time every year. If you're like most people with SAD, your symptoms start in the fall and continue into the winter months, sapping your energy and making you feel moody. These symptoms often resolve during the spring and summer months. Less often, SAD causes depression in the spring or early summer and resolves during the fall or winter months. Well, I would say that normally I would be much more inclined to be energetic in the cooler months and less energetic in the warmer months, but this year's been a little bit different, and I'm wondering if it does have something to do with this seasonal affective disorder. We are in the heart of the winter right now, and this year, for some reason, it's been more cloudy than normal. We haven't really had a lot of sunny days, though it hasn't been bitterly cold where I am. But it just hasn't been the kind of weather that it makes me feel like getting out and taking a walk, although I realize that probably would do me a lot of good for more reasons than just being exposed to more sunshine. But they talk here about the symptoms of SAD. Feeling listless, sad, or down most of the day, nearly every day. And I think listless would be a better description for me. I'm not really sure I feel sad exactly. I just don't feel very energetic compared to what I'm used to. And the next one is losing interest in activities you once enjoyed. And again, that could be MS and that could be seasonal affective disorder, right? One can't be sure where one ends and the other begins. Having low energy and feeling sluggish. Okay, definitely that's true for me right now. Having problems with sleeping too much. This one caught my attention because I'm not usually one who needs a lot of sleep, but what I'm finding is that I'm ending up taking a nap in the early evening for a couple of hours, waking up for a couple hours and reading or doing something else, and then going back to bed and pretty much sleeping through the night. That's not normal for me, but I wonder if it doesn't have something to do with this seasonal affective disorder. Next one is experiencing carbohydrate cravings, overeating, and weight gain. Gosh, I cannot even begin to know whether that's true for me or not. Our schedule has been kind of nuts lately. We've been helping a friend, and we've been driving down to her place a couple of times a month, and that's very disruptive to the normal routine. And I've been blaming my weight gain on just that, basically. But, there could be more component to it than I'm giving it credit for. The next one is having difficulty concentrating. Yeah, I think so. I was looking this morning for something that normally I would have been able to put my hands on very quickly because I would have put it in a certain spot and it would be there. But we were looking all over the house for it today and we never did find it. So I guess when I put it away, I wasn't really concentrating. The next one is feeling hopeless, worthless, or guilty. Well, no, no, and no. And I've been on your case about that too, that you should never feel like you don't have value. I know there are days when we're tempted to feel that way, but we never should. Because our worth does not depend on how much energy we have and how full of vim and vigor we are and what our symptoms are doing and what our body's telling us. We are worthy in and of ourselves. And then finally, having thoughts of not wanting to live. I have never had this, and I'm thankful for it. And if you have had thoughts of not wanting to live, please, please, please see somebody, talk to somebody. There are all kinds of resources for folks who are in that situation. But don't just ignore it. Don't just pretend that everything's okay. That's serious. And it could be from many causes. There's no need to feel ashamed of it. Just get some help, please. And then for fall and winter specifically, here are the symptoms. Oversleeping, we already talked about that. Appetite changes, especially cravings for food high in carbohydrates. Weight gain, tiredness or low energy. Okay, I'm guilty on like all four of these, so I think this could actually be part of my problem. I shouldn't go blaming MS for every single thing that goes wrong in my life, because even people with MS get other medical problems too. So far I'm thinking maybe there's something to this. And then of course, if you have the same thing going on, but the warmer months tend to bother you more, the symptoms you might have would be trouble sleeping, poor appetite, weight loss, agitation or anxiety, or increased irritability. And I actually have a couple of those all the time. So I don't even know what causes some of those. But it might be this. Who knows? But that's something to think about. And I'm glad that I saw this list because it's giving me some food for thought. Now they go down here to the causes, just so we can see. There's 3 causes that they name. One is that your biological clock or circadian rhythm has been thrown off. The reduced level of sunlight in fall and winter may cause winter onset SAD. This decrease in sunlight may disrupt your body's internal clock and lead to feelings of depression. And the second one they give is your serotonin levels. A drop in serotonin, which is a brain chemical or a neurotransmitter that affects mood, might play a role in SAD. Reduced sunlight can cause a drop in serotonin that may trigger depression. And you know that depression and fatigue and multiple sclerosis are good friends from long ago. And so again, where does one begin? Where does one end? We can't even draw a firm line there. But we can see that this is a chemical thing, and it's not even something that has to do with external circumstances. But if that feels like what you're experiencing, it might be something like this. It might be seasonal affective disorder. And then finally, the melatonin levels. The change in season can disrupt the balance of the body's level of melatonin, which plays a role in sleep patterns and mood. And we talked about some of those things that you would notice about your own life and how things have perhaps changed in how you're living. Maybe one of those things resonates with you. And then they talk about some risk factors. And here are the ones that they name. Family history. People with SAD may be more likely to have blood relatives with SAD or another form of depression. So that's something that you might be aware of given your own family history. The next one they put down is having major depression or bipolar disorder. And I would also say multiple sclerosis in there. They don't list it obviously in this one, but if you have multiple sclerosis, you have a tendency toward fatigue, toward depression. So it could definitely be exacerbated, if not directly caused by seasonal affective disorder. And then living too far from the equator, yeah, so the higher latitude you live in, the more likely it is that you would experience these symptoms. And we've seen this before, where they have the map of the United States and the prevalence of MS, and the map of the world and the prevalence of MS. And it is not a perfect correlation by any means, but the countries that are further from the equator seem to have more occurrences of MS than the others. And I would think that seasonal affective disorder could be a problem in the same areas. There might be a lot of overlap. And then finally, low level of vitamin D. If we have low blood vitamin D, that may also contribute to it. Now, that's become kind of a controversy, not really in the sense of vitamin D being bad for you, because no one is really saying that. But what studies are looking into is whether, when we talk about how sun exposure is good for us in terms of depression, fatigue, seasonal affective disorder, is it because of the vitamin D that's produced, or is it because of the sunlight itself? There's just something that sunlight does, psychologically as well as physically, that improves our mood and lifts that sense of fatigue that we tend to be dogged by when we get into the season that just saps all of our energy away. And then there are some complications that they list, and you could see for yourself how this condition would lead you to these things: social withdrawal, school or work problems, substance abuse, other mental health disorders such as anxiety or eating disorders, and finally suicidal thoughts or behavior. And then they talk a little about prevention. And it's always so wonderful when they start right out with, there's no known way to prevent the development of seasonal affective disorder. Sounds a lot like MS in that regard. However, if you take steps early on to manage symptoms, you may be able to prevent them from getting worse over time. You may be able to head off serious changes in mood, appetite, and energy levels, as you can predict the time of the year in which these symptoms start. Treatment can help prevent complications, especially if SAD is diagnosed and treated before symptoms get bad. And then they say that some people find it helpful to begin treatment before treatment would normally start in the fall or winter, and then continue treatment past the time symptoms would normally go away. Other people need continuous treatment to prevent symptoms from returning. So again, it's very individual, and you'd have to try various strategies to see what works for you. It does sound an awful lot like the way MS is, doesn't it? Very individualistic. Well, I found this article in MS Focus magazine. 4 symptoms seasonal affective disorder and MS have in common. Living with MS is complicated and can be tough to manage on a day-to-day basis. When winter rolls in and the seasons change, living with MS may get more complicated. During the wintertime, the days are shorter and the temperatures outside are colder. These changes can lead to seasonal depression, commonly referred to as seasonal affective disorder. Did you know that SAD and MS have common symptoms? Well, let's take a look at what those might be. The first one they list is fatigue. Well, yes, certainly that. Fatigue is one of the top symptoms reported by those of us living with MS. Fatigue is also one of the top symptoms reported by those affected by SAD. How do you differentiate whether your increased fatigue is attributable to MS or SAD? First, consult with a doctor. Report all of your symptoms from a historical basis. Mention whether you feel more energy during the spring than the winter. Second, keep a health journal. If you notice increased fatigue when the seasons change, mark that in your journal. If you notice a pattern over time, then you may be experiencing symptoms associated with SAD. Well, you're going to have to come up with sort of a rubric of your own, I think, with that, because that's very subjective, right? Every day, what are they going to say? Well, on a scale of 1 to 10, how fatigued do you feel? Well, compared to what? I guess I would have to figure that out. What would be my own personal yardstick for fatigue? But just keeping a journal about your fatigue in a subjective way might be a little tough to, again, tease out what's going on. And the second symptom that they list that we have in common are sleep disorders. Many people living with MS experience insomnia or some other sleep disorder. People that have SAD are also affected by sleep disorders. Common symptoms include greater need for sleep, sleeping longer, or interrupted sleep. If you have trouble sleeping, report them to a doctor right away. Sleep is something we need to restore and heal our bodies. If your sleep schedule is interrupted, it can have negative consequences in other areas of your life. Your doctor may recommend a sleep study to better understand your sleep disorder. And then symptom number 3 that we have in common are problems concentrating. Many of us living with MS have experienced either visual or cognitive issues which may affect our ability to concentrate or focus. Did you know that people experiencing SAD also have trouble concentrating? Whether it is a function of the increased fatigue or sleep disorders, people experiencing SAD have problems concentrating. Problems with concentration can lead to the inability to accomplish daily activities, which may lead to increased frustration. I think we all understand that cycle pretty well. This is a tough cycle to break. Reporting these symptoms to your physician is an important way to break the chain. And then finally, mood changes. When you are experiencing symptoms common with MS or SAD, it is easy to isolate yourself. Whether it is canceling commitments to stay home, avoiding contact, many people desire to stay alone when symptoms are acting up. Irritability and other changes in mood are common occurrences as well. There are many different factors that can affect your mood, so it is important to let your doctor know right away before the isolation and irritability take over. I would say of the 4, this is maybe the one that I needed to be reminded of the most, because I'm going through a phase right now where being alone at home, just doing my own thing, not having any commitments, the telephone doesn't ring, nobody knocks on the door. I'm actually loving that. And that's a little weird for me because I'm an extrovert. I've always tested as an extrovert, but I don't feel very extroverted lately. A continuing theme through these 4 symptoms, fatigue, sleep disorders, problems concentrating, and mood changes, is to discuss these symptoms with your doctor. Both MS and SAD can make you feel alone and isolated. Problems with fatigue, sleep, or concentration may lessen your ability to make a good decision. And these are things your doctor needs to be aware of. Are you getting a theme here? They really want you to tell your doctor if there's stuff like that going on. And I would guess that if you went to your neurologist and explained to them you were having all this going on, it might be tempting for them to just say, well, it's your MS. I mean, they don't see you every day. So if it is really something significantly different from your normal, especially if you're in progressive MS and it's not going to show up on your MRI, even if you're having MRIs anymore, because often with progressive MS, they don't even do MRIs very much. You really want to let your doctor know, look, I know all these things are common MS symptoms, but they're not normal for me. Maybe we need to look at this a little differently. And then they go on to say that the difference between SAD and MS is that SAD is most likely to occur around the same time each year. If you have SAD, you can probably set your clock to when your symptoms will occur. As a person living with MS, it is important to make the differentiation as to whether your symptoms are a result of SAD or MS. Look back on your personal history. Do these failings happen around the same time each year? Keeping a health or symptom journal will help you determine whether or not these symptoms spike during a certain season. And then we've already talked about that. How best to do that in a way that's not so subjective that it's really not all that easy to tease out what's going on. And then finally, they talk about what you can do about it. Here are some of their suggestions. You can spend more time outdoors each day. Even if it's cloudy outside, there is a benefit to being outside. And this has definitely been proven true, that sunlight exposure seems to help people with their moods. And the second suggestion is to eat right and exercise daily. Yes, yes, we need to do that. Quality of life demands that we take care of our bodies. Winter is also the holiday season. It is easy to overeat. And not just to overeat, but to eat the wrong things. Eat things that aren't even really all that good for you. A lot of the things they call goodies, they really ought to call baddies, as far as I'm concerned. And I'm as bad as anyone else, though, when it comes to enjoying them. But I've realized now that I need to just sort of let the cookie plate go on by as often as they possibly can. So they say making sure you eat right and exercise will help combat sad symptoms, and it will also help your MS, of course. And then finally, look into light therapy. There are special lights that simulate natural light and are thought to be beneficial to those suffering from SAD. We talked a little about that. I think there are so many options for light therapy. You might want to see with it before you spend a lot of money, because there are options that don't cost very much. There are also options that cost quite a bit. You might want to try something simple, and if that helps you, then maybe invest in something that's a little more expensive, like the fake window. You can even put curtains on it if you want to. But these full spectrum lights really do help with your mood. I've noticed that myself. I use one in the morning for a couple of hours, and it just starts out the day in a more positive way, especially this time of year, since it's often cloudy, if not downright raining or worse. And then finally, they say that living with multiple sclerosis is complicated. Trying to determine whether your symptoms are MS related or are made worse by a condition like SAD is difficult. Your doctor can help you make that determination, but in the meantime, get outdoors, stay active, and eat right, as it might help. And again, I think if you go to your doctor with anecdotal data, you're not really going to get anything other than, well, what do you expect? You have MS. Or they might want to put you on some kind of antidepressant, which would be even worse in my point of view. But if you can really document in a more, I don't know, in a more scientific way, maybe, if that makes sense, in a more quantitative way, maybe like using that scale of 1 to 10 idea or something, it might make the doctor pay more attention to you and give you an answer that's a little bit more thoughtful. And I would never, of course, suggest that doctors wouldn't be thoughtful. It's just they see a lot of people every day and they're kind of pushed for time. So if we don't come to them with what we need, we can't blame them if we walk away dissatisfied. And then I just wanted to pull this up. I am not going to go through it in detail, but I just wanted to let you see that there is indeed research that's done in this area from time to time. Though I went out to clinicaltrials.gov and there really wasn't anything going on right now. Maybe, here's the cynic in me again, maybe because sunlight is free, and if that's the prescription, I don't think that the pharmaceutical companies are going to want to fund any research on it. But this is a study that was published in 2020, I believe. Sunlight exposure exerts immunomodulatory effects to reduce multiple sclerosis severity. So according to what they were finding in the study that they did, by being exposed to the sun, we actually affect our immune system. This is called photoimmunomodulation, and I looked up what I could on that. Didn't really find anything that was all that relevant to us, so I'm not going to pull up much on that. But I will link this paper in case you're interested. As you see, it came out in December of 2020. But it does go to show you that some of the scientists are looking at whether there's something in sunlight itself, beyond just the vitamin D component, that is beneficial for everyone probably, but certainly with people with multiple sclerosis who tend, let's face it, we tend not to be as outdoors as often as we once were, if we ever were. I mean, if you were an outdoor person and all of a sudden you can't do the kinds of things you used to do outdoors, the tendency is to want to stay inside. I know that's true for me because we used to take long walks, go to all different kinds of towns and different places and take walks so that we got to know the Northwest. We were all over it doing walks. But now that I can't do those long walks anymore, my motivation to get outside is pretty much gone. So I really have to make myself get up and go outside. I don't know if you're in that boat or not, but if you are, be creative about some things that you might be able to do that would make being outside more enjoyable and something that you can get motivated to do. Well, I don't know about you, but I think I'm going to renew my commitment to getting a little more sunlight exposure. Even though it's cold and cloudy much of the time up here at this time of year, they say that it does help to get even a little bit of sun exposure. I also have one of those lights that helps with the full spectrum, but I wonder if I'm using it as effectively as I should be. And maybe I need to look at that a little more. I will let you know if I come up with anything brilliant. But in the meantime, I think it's just important that we do what we can to make sure we're not blaming multiple sclerosis for everything that's wrong with our quality of life. Maybe there's something we can do, if not to fix it, at least to make it less burdensome and bothersome. But that's all I have for you today. So until next time, take really good care of yourself. I'll see you again soon.